Okay, so the next section, we're going to talk about rheumatic fever. And it will also have its own section because there's a little bit more information. So rheumatic fever is inflammation of the joint, skin, brain, and heart that can potentially damage cardiac valves, and the mitral valve is the one that's most often affected. So what's the etiology? How does this happen? This is an abnormal immune response to a group A strep infection, most often strep throat. It's most often seen in children and adolescents. It's more rare in adults. Acute rheumatic fever is self-limited, but if it's not adequately treated, that inflammation can damage heart valves. Rheumatic heart disease is the chronic damage. It's the chronic sequela of acute rheumatic fever. It's associated with incompletely treated or untreated strep infection. So I am dating myself here, but if you have ever read or seen Little Women, Beth died of rheumatic heart disease. Okay. Beth went to visit the family that had the morbid sore throat. The morbid sore throat is strep throat. And then discovered they had scarlet fever. She got scarlet fever. Scarlet fever is a strep infection. And then she had, after she had scarlet fever, she had rheumatic fever as an immune reaction to that. And you can, if you know what you're looking at, you can see that in the book. And then she died she died sometime later of rheumatic heart disease. So that was very common before antibiotics. We still sometimes see rheumatic fever because people don't take antibiotics properly. So what does this, let's look at diagnosis. A provider is going to diagnose this based on manifestations and strep antibodies. So if they have a patient they suspect has rheumatic fever, they check for strep antibodies that'll show they've had strep recently, and then they look at the criteria, they look at the manifestation. So the modified Jones criteria, they know everything after a person, is either 2 major manifestations or 1 major and 2 minor manifestations. So the major manifestations are tachycardia. When we have fever, we're always tachycardic, but if we have tachycardia that seems to be more than it should be for that fever, that's considered a major manifestation. Cardiomegaly is an enlarged heart. They might see that on X-ray or ultrasound. A new heart murmur or a change in an existing murmur. Muffled heart sounds. A pericardial friction rub, when you can hear a rubbing sound from that inflammation with every heartbeat. Chest pain, EKG changes, and most commonly you're going to see a prolonged PR interval. Polyarthritis. Arthritis tends to be in large joints and it moves to different joints. So they might have knee pain, or then they might have shoulder pain, and those joints may be red, hot, and swollen. Erythema marginatum, they have red areas with a clear center and a wavy, well demarcated borders. They have a border that you can trace. And they have the rash is red with a clear center. It doesn't itch and it's transitory. It comes and goes. Chorea is a movement disorder. They may move their limbs. They may have facial grimaces, speech disturbances, muscle weakness, and emotional lability. And if they try to control those abnormal movements, it gets worse. If they're stressed or tired, they get worse. When they're rested, they get better. Okay, so chorea. And subcutaneous nodes, they're non-tender nodes over bony prominences. So those are the major manifestations. If they have 2 of those, and they are positive for strep, that's considered rheumatic fever. If they have 1 of those and either arthralgia, joint pain, or fever, that's no, they have to have 2 minor, arthralgia, and they have arthralgia and fever. That's considered rheumatic fever. In the acute phase, they also may have elevated sed rate and CRP, which indicate inflammation. They also may have supportive evidence of a strep A infection. So think about what would make you suspect this. You're taking care of a child, and what would make you suspect that maybe they have rheumatic heart disease or rheumatic fever? It's important because this is another one of those diagnoses that can be missed until there are severe consequences. So first of all, nursing is really critical in prevention. We need to be alert for a potential strep infection, refer that to a provider for treatment. So prompt recognition and treatment of strep infection. And then we need to teach antibiotic use. How do they take antibiotics correctly, make sure they're completing the prescription for antibiotics. So then treatment for this, they're going to get antibiotics. They're going to get salicylate. So they're going to get aspirin usually for the inflammation. In the acute period, they're on bed rest to decrease the inflammation. As they're recovering, we want them doing quiet activity. So there's a gradual return to activity. Once they're recovered from rheumatic fever, then they usually get secondary prophylaxis. Most of the time, that's a penicillin shot every 28 days. If their heart was not affected, then they do that for 5 years or until they're 21. If their heart was affected, they have carditis, it's 10 years until they're 21. If they have rheumatic heart disease, they may actually get that penicillin shot once a month until they're age 40. Rheumatic heart disease can cause permanent damage to the valves, usually the mitral valve. So that can lead to heart failure. Nursing care, prevention. We want to catch those infections that might be strep and refer them. We want to encourage compliance with meds, help them figure out how to get those meds taken appropriately, make sure people understand they need to complete the prescription, don't share prescriptions, don't split a prescription between 2 kids or save some for the next round of strep throat. We want to facilitate rest, give lots of emotional support. One of the most frustrating symptoms of rheumatic fever is chorea. And the chorea may last for months. That's those involuntary movements. It's frustrating for the child, but it's also frustrating for adults. And sometimes kids will get in trouble for those involuntary movements because teachers think they're being disruptive. So we need to make sure that their teachers are educated as well. So that's rheumatic fever and rheumatic heart disease, and this is why we treat strep throat.